All right, hey ho, let's go. Let's do this. My name is Dr. MarkAlain Dery. I am the Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana. I live in New Orleans, Louisiana, and I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section. You see me do these updates now for a long time. In conjunction with leadership of the ACOI, I hope these messages are helping you to keep up with the latest of COVID-19. I know that many of you are in the thick of the fight. I'd like to thank each and every one of you on behalf of all of us who focus daily on infectious diseases, and certainly on behalf of the ACOI. And as always, thank you to ACOI for allowing me to do these videos. So moving forward, together with the ACOI, we will continue to share information as it becomes available, as well as some of the hopeful progress that we're seeing. So now on to the story. But before we do, I just want you to know, look forward to some show and tell. There's going to be some show and tell coming up very, very soon. This is a mask. But you have to wait, all right? So let's talk about the CDC, because they finally are speaking up. Oh, where have they been all this time? I've been waiting. CDC, let's go. Yalla, yalla. All right, so the CDC has been busy making announcements, and I want to start to announce some of them right here, right now. First, let's talk about those who have been fully vaccinated. I'm sure it's a lot of you. And that means individuals that have had either 2 doses of Pfizer or the Moderna vaccine. What can they do now that they couldn't do before with respect to the things that they need to do? So first, they can continue to take precautions, masking. This is not the show and tell part. Did you love the two-tone? Matches the two-tone? You think it was an accident? It was not an accident. So they have to wear masks, continue to avoid crowds, social distance, and then of course hand washing. That we're infectious disease doctors, so we love that. But the good news is that they have. But the good news is that they have been exposed to somebody with the virus. The Centers for Disease Control said this week that they don't need to quarantine if they meet the criteria that the CDC posted online, which is they must be fully vaccinated, so 2 jabs, as the Brits like to say, 2 jabs, and it has to have been past 2 weeks since the second shot, because it takes probably around 2 weeks to build full immunity after that second dose of the vaccine. But, and this is a biggie, the CDC said that they don't know how long protection lasts, so people who've had their last shot more than 3 months ago should be quarantined if they are exposed or if they begin to show symptoms. So tell your patients to remain vigilant, and not just in how they're feeling, but also keeping close track of the fate of the date of their vaccine. To me, this seems a little silly, because why would you tell people for 3 months they don't need to? They should have just never done it in the first place. But I'm not in the CDC, and if I was, I would have made that recommendation. Okay, now whether you're vaccinated or not, remember that vaccinated people could harbor vaccines in their noses and throats and transmit it to others. So if your patients get the vaccine, educate them that they must remain socially distanced from others, and they must continue to wear masks. They must continue to wear masks, all right? So what else is the CDC saying? They're saying that 2 masks, this is the show and tell part, 2 masks are better than 1. They just finished a study, and the research suggests that when a person double masks, so for example, wearing a surgical mask with a cloth mask on top, so like this and that. I usually keep my nose low so that people can see that I am wearing so they can see that I'm wearing a double mask. That when you wear a surgical mask and a cloth mask on top, the people around them, when the people around them do the same, the risk of transmitting virus falls. You are safe 95% of the time, but in the study, the benefit fell to 80% if only 1 person wore a double mask. So a better fitting mask also has benefits, and let me show you what the knot and tuck method is. And so they essentially just took masks and they knotted it very close to the edge there, and they took that extra excess and they put it inside like this. This is what they refer to as the knot and tuck method. This is one way to tighten masks, and the closer the fit, the better. And combining the close fit of a cloth mask with the filtration of a surgical mask is a good idea. So there you go. And recently I just flew and I tripled mask. So I wore a KN95, I wore a surgical mask over that, and then I wore this cloth mask over that. It's hard to breathe, but that's good. There's nothing wrong with hard to breathe. I just took my time getting to where I need to go. So remember, getting the vaccines is not a free pass to foregoing public health measures. Only 10% of the US population has now received the vaccine, so we are not at herd immunity. We're far from it. And remember, no shot obviously offers total protection. So it's what's my personal recommendation? I think this knot and tuck method is difficult, and I think that it doesn't really create the seal that they imply that it does. So I am telling everybody that a surgical mask, these are $5 for a box of 20 or 30, maybe even cheaper than that. If these are worn with a cloth mask over, you're going to get the best protection. You're going to protect other people from yourself and other people, and you'll be protected from others as well. Okay, so while we're talking about COVID vaccines, let's talk about some of the myths. So I'm sure you're hearing about a lot of these myths, and for us to get back to normal, we have to reach herd immunity, but then we have these anti-vaxxers, and I have spoke about anti-vaxxers at the ACOI conference. I think maybe about 7 years ago, I did a lecture describing who anti-vaxxers are. And I actually thought I was going to go in there to make fun of them, quite frankly. But then I realized that I was going to be punching down, and I don't punch down, I only punch up. And so I actually ended up not making fun of them. But it's actually really quite sad, anti-vaxxers. I'm sure you know and are aware of them in your own personal lives, and you understand. But we have myths now propagated all over social media. Social media. So we must do our part as providers to expose the truth about the vaccine. So first, according to Pew Research Center, 44% of Black adults have indicated that they would not get COVID-19 vaccine. Yikes. This vaccine hesitancy partially stems from decades, centuries of racism and oppression entrenched in our healthcare system. Now, here's some facts to dispel all the rumors in case you have patients popping in your office with some of these tall tales. One is the vaccine doesn't track you. For some reason, people think that there are microchips inserted to track you, and I just remind people that that's not what a microchip is, and that's not how they work, and nobody is tracking anybody. Okay, an mRNA vaccine, what about it? Does it alter your genetic code? What? See, that's another completely false rumor. It's not possible. DNA replicates and stores your genetic information, whereas RNA converts that genetic information to build proteins. I'm taking you back to your molecular biology days in medical school. So just as a refresher on how this works, the vaccine injects you with an mRNA sequence that has been coded to produce the specific proteins on the novel coronavirus. So our cells and our bodies essentially become spike protein manufacturers, which is really cool, okay? And it's very organic, right? Because our cells are the ones that are doing it, and they're building the protein specified to the mRNA code that recognizes the protein of the coronavirus, that spike protein, and then it creates antibodies to fight it off. So that way, if your body ever encounters COVID-19 again, you are equipped and ready to fight that virus, and it will be neutralized. Another myth is that the vaccine causes infertility, and these rumors, and this is the most insidious, because this one affects, according to research that was released earlier this week. Unfortunately, this is specific toward Black Americans, but Black Americans that are of child rearing years. There is a sense or a fear of infertility. So these infertility rumors originated from an article published by a blog called Health and Money News. As previously reported by the New York Times, the Health and Money News falsely claimed that the Pfizer vaccine contained ingredients that could train the body to attack a protein that aids in the development of the placenta. Wrong, no. we need to be vaccinating people and not spreading these rumors. Remember, disinformation has an R naught, right? Remember what an R naught is? Has a R naught is if a virus, how many, an R naught describes how many people a virus can infect, right? So the coronavirus has an R naught of maybe like 3, right? HIV has an R naught of 3. Measles has an R naught of 19. Disinformation has an R naught of 6. In other words, it spreads 6 times faster. Okay, so immunity to COVID-19 does not come directly after taking the vaccine. This is not a myth. This is true. Your body needs about 14 days after the second dose with either the Pfizer or the Moderna vaccine to reach that 95% effectiveness. Taking over-the-counter medications before getting the vaccine may impact immune response. So there is no research on this, but there have been some past studies that have shown taking pain relievers before getting a vaccine can yield fewer measurable antibodies. I don't know if they looked at memory cells, but at this point, people are just telling, just don't take an anti-inflammatory pain relievers before you get the vaccine. It's fine to take it after. This is probably the question I'm getting about more than anything else. Now, finally, it's that time, Mardi Gras. I go all day. Don't board that plane and head to the Big Easy, because Mardi Gras this year is no. We are not having it this year, and largely due to the fact that last year we had a huge super spreading event that occurred, and an article that came out this week actually documented that. And the headlines are quite shocking. Our 2020 Mardi Gras in New Orleans is said to have created up to 50,000 cases from one source, from Texas. Now, it's a timely article considering that it's traditionally Mardi Gras season. Typically, my city right now, what time is it? Oh yeah, we'd be at parades right now. Thursday night that I'm recording this before Mardi Gras is the big music. In fact, I think I would be in the parade right now. I'd actually be playing the bass drum. Come to think of it, I actually, no, what am I talking about? I'm in the Rolling Elvi. We would be, I'd be scootering right now through the streets of New Orleans, dressed as the king, but of course I either do the punk rock Elvis or I do the Condom King Elvis. Get it? The Condom King. So with this right now, so it's crazy, but we had to say no to parades, of course, because of the fact that this is a super spreading event. Of course, it was the signature event that made New Orleans an early COVID hotspot. And a new study released found that while community transmission was happening in New York City and Washington State and Santa Clara, California, the big event where over 1 million people from all over the U.S. came to New Orleans, our Mardi Gras, which began with parades on February 14, lasted through the 28th, was one major super spreading event. Researchers at Scripps, Tulane, at LSU, and several other institutions said, and this was a preprint, okay, so it was in a preprint, but it was released this week showing that coronavirus probably arrived in New Orleans about 2 weeks before Mardi Gras Day or Fat Tuesday, and they think it was from a person that traveled from Texas. Now, as unreal as this sounds, get this, over 800 people were infected by the time all was said and done by Ash Wednesday, right? So by the day following Mardi Gras. Now, the study then shows that those 800 people transmitted that to 50,000 people around the country. So how did they figure this out? They looked at death data. They started working backwards using genome sequencing as well as cell phone tracking data to simulate how likely it was to transmit. They created cruise-like conditions, or they stated that the event created cruise-like conditions, meaning it spread differently in New Orleans than it did elsewhere. It resulted in making New Orleans a city with the highest deaths per capita from COVID-19. And I remember those days, and it was very intense, and it was very scary. And just as I'm thinking about it right now, it's giving me anxiety, just as I'm sure it does for all of you thinking back what those early days were like. Here in New Orleans, it was very, very, very anxiety-inducing. Anyway, so as the city looks ahead to Mardi Gras, which would be happening right now, and it's going to look very different this year with all the bars closed. Pedestrian traffic is highly and very, very significantly limited. Our famous Go Cups are banned. That means you can drink in the streets. Yes, we drink in the streets in New Orleans. Okay, that's just the way it is. So there's no go drinks, there's no drinking in the streets. And the study authors hope their findings will serve as a warning about the downstream effects of gathering while the virus circulates. It's very sobering indeed. So stay on the lookout for our regular updates, and to read more from sources used in this report, please go to the ACOI.org/COVID-19. Together with the ACOI, will help you with the latest information to help you respond with your patients and stay on top of the crisis. And as always, please feel free to be in touch with me directly at madery@mac.com. Please stay safe. We can do this together.